Over to you, Garth.
Okay, well, firstly, I'd like to begin by acknowledging the traditional owners of the land where we're all situated today. I would also like to pay my respect to elders past and present. I'd like to welcome everybody on the webinar here today. And this is basically being put together in the absence of our usual symposium, which should have been next month. So when talking to the board, we made a decision that in lieu of not being able to attend conferences and do symposiums, this seemed to be the next best thing, and in some cases probably is more efficient and effective to actually start putting webinars together for our members, because pulling an hour out of the day sometimes is a lot easier than asking someone to attend a full day, and only so many people can get there for the full day. This is the second of our series. We had one a while back run by Lynn Maker-Blatch, our past executive officer, that was done by Zoom. And we're asking that because of the COVID situation is so in our face at this time, I thought this was very opportune to take a time to talk to our colleagues in Melbourne, Victoria, of what they're experiencing and how they're managing the current situation, because a lot of us and our colleagues overseas are already in amongst this situation of having put outbreak management plans and all types of plans together. I'm going to cut it there because we've only got limited time. Welcome everybody. I'm going to hand it to Vanessa Brumbell, who's our new Executive Officer for the Australasian Therapeutic Community Association. And I'm going to hand it over to you, Vanessa, to introduce the panel.
Okay, thanks, Garth. Hi, everyone. Okay, I'd like to just remind everybody that this is going to be filmed, so I will make it available at some point later on, a link available to all the members so that you can pass it on to people who may have missed out. Also, there will be time for questions at the end, so if you use the question and answer tab, I'll get to it at the end and we'll see how we go. If there's room to interject, I'll do that as we go along. Okay, so firstly, we'll just get straight to it. We'll hear from Windana. So we have Claire Davis, the Executive Director of Rehabilitation Services. We have David Scott, the Manager of Rehabilitation Services, and Jade, who's a resident. And they'll be discussing how they're adapting to the COVID pandemic. Thanks, everyone who's starting. Claire, you?
Vanessa, yeah, I'll start. So okay. What I thought I'd just commence with is just a very, very brief overview of where we're up to in Victoria. So Victoria entered a state of disaster at 6 p.m. on Sunday, the 2nd of August. Which is due to go for, well, not the state of disaster, but the stage 4 restrictions that went with it are due to last for 6 weeks. That takes us up to the 13th of September. The state of disaster effectively gives police greater powers to ensure people are complying with all the public health directions that have been put in place. When stage 4 came into play for metropolitan Melbourne and Mitchell Shire, at the same time regional Victoria went into stage 3 restrictions. So what that means is a lot, actually. It means that it's mandatory mask wearing, curfew. I've never lived anywhere where there's been a curfew, but curfew between 8 p.m. at night and 5 a.m. every day. You can leave your house for 4 reasons: shopping for food, exercise, caregiving, or permitted work. And the caveat there is you can only leave your house for 1 hour every day. To be honest, even just saying that still sounds a bit bizarre, but that's the sort of the state of play at the moment. For Windana, I'm just going to talk to Windana from an organisational perspective, and David will talk probably about more the program level, and Jade will give a resident perspective. What that meant for us, though, was from an organisational level, we had to issue everyone with a designated official permit for being a permitted worker. And we had almost, and the others might be able to help me out here, but it felt like about 2 minutes to get that organised. I think it was about 24 hours that we had to get everyone with a permit. which was actually quite an ordeal, getting, you know, everyone's details on that form and getting everyone's rosters. Everyone's rosters got to be on the permit as well. And thank goodness we did it, because there were police and ADF checkpoints set up all over the place waiting for us to show them those permits. We also have had to do a lot of work around social distancing. That's been in place since the beginning of the pandemic, but we really had to enforce that. For Windana, that means that we're operating using about 75% of our beds. The rest of them are designated as isolation areas. So if anyone comes down with any of the symptoms, we isolate them in the isolation area and work through the isolation procedure. Windana stopped taking any new referrals from March. At that point, there was a big decision to sort of say we're not going to take any new referrals, as if we'd ever want to do that. But we already had 200 people waiting to get in, and that's just to the TC. So we've got about 97 beds across the 2 TCs, and we had 200 people waiting at that point to get in, which meant that we had to actively be almost case managing those people, which is, we just couldn't manage any more than that. We haven't taken any more referrals since March. Today, I can tell you we've still got 138 of those waiting to get into the program. So and we only have probably about 170 that come through each year anyway. So we've almost got a whole year's worth of people waiting on the list as it is. The Grampian service continues to admit people at the moment because they're in stage 3. And we predominantly are taking people into the program in that area from rural and regional areas. We've had multiple policy changes in Victoria. They've often come in short succession, and we've often heard them through the television. And the only other time I've worked in an environment like that was when I was working in with the unaccompanied minors in the detention centres. So it's really reminiscent of one of those high-level, intense crisis environments, hearing that breaking news, and then almost this flood of work that comes out of each one of those announcements. There's been sometimes conflicting policy direction where we've had to find out, you know, even through my colleagues on this webinar, what do you think that means? Running it by other people, checking out with DHHS what their interpretation of it is. It took a while to get any direction about AOD services in general. We were operating off sort of aged care guidelines and whatever we could sort of put together. That's a lot better now. Probably the most recent one for us though was some advice that came out probably it might have been about a week ago around PPE, saying that now the staff also needed to wear goggles on top of the mandatory masks, that they also had to wear goggles. So it's just in an environment that would be like this, you'd have the time to check it out, but it's just not like that at the moment. Constantly sort of looking at business continuity planning, emergency prep and surge planning has been a big part of my day for the last couple of months. You're just sort of left with that feeling of wanting to make sure you haven't forgotten anything. And lots of work around infection control and prevention, revising policy and procedures with those updates as they come through. It's been a lot of work, lots of long hours. More recently in Victoria, there's been quite a few of the withdrawal units that have had positive cases, and it's been not great to watch that. One of the Windana units, the youth unit, had to be closed for a short time due to a positive case. What's come out of that though is some really good learning for us around where there may be gaps in our knowledge, in our procedures, and we've been able to update those as required. For me, like personally, there's probably been a sense of waiting for it to arrive, which I do not like. I do not like that feeling, but that has been the feeling. And I suppose personally what that's meant for me is just make sure I've gone through all those checklists about 100 times, and I'm almost to the point now where I'm thinking of them in my sleep, the checklist, to make sure we've got it all right. We've had great support though from one another. There's been a residential services network that I've gone to, and other webinars where I've checked in with people that have been really vital for my well-being, and you know, to pass on those sort of strategies to other people. Windana's also had a big focus on staff well-being, and we're putting in a whole heap of initiatives around looking after our people as best you can in these really challenging times. So that's probably enough from me. I've also really loved all the memes and all the dark humour. I always love that in this in TCs, but it's been extra beneficial over the last couple of months. So I'll hand over to David if you want to talk about the program.
Thanks, Claire. Hopefully you can hear me okay. I'm obviously having to wear a mask. I've got a lot to say and not much time, so I'm going to kind of fire through. So try and keep up with my Scottish accent as well, because it might get a bit loose. There's so much to talk about, but I think the three main areas I would like to mention are how we've adapted the programme, retention and staffing. And looking at adapting the programme, like we're actually now into our second lockdown. The first one was stage 3, and now we're in the middle of a stage 4. And I would say this is normally our settled period of the year, after we come through fire season. And you may be aware that Victoria was badly affected by fires over the past 2 years. And we've actually evacuated on 3 times over the past 2 years. So we got through fire season, and then COVID came along swiftly after, and it kind of keeps on giving at the moment. So like, how did we adapt? We changed the timetable. It actually gave us the opportunity to do this. We've been waiting for a couple of years, or thinking about it, since we increased our beds up to 77. And just to modify what it needs. So it gave us an opportunity to actually do that. So with the residents, we made the changes, and one of the biggest changes was the education and therapy group times went from 1.5 hours down to 5 minutes. We brought in more slots for residents to call their children, family and friends. You know, there's no visitors here other than essential services, and obviously no leaves. And I have to commend the patience and understanding of the residents throughout this whole time. It's not been easy. Social distancing is obviously a big one. Every room at the TC is a maximum number of people that can be in the room at any one time. The dining room was thinned down as well, 2 seats per table. Resident and staff social distancing groups, and even some of our staff meetings, we might all be on property, we're actually in different rooms zooming in as well, so it's got its challenges. COVID signage is everywhere, you know, on the entrances, on the doors. We've had DHHS come out from the Public Health Division, known as the Tiger Team. They've reviewed our practices, they were happy with that. 2 of our pods, 4 beds have been taken offline. Portable hand washing stations were brought in, and we've since plumbed in new hand washing. Wearing masks is obviously a big thing. I'll get onto that in a little moment. But also, like, just some of the projects that we could manage to do around the TC as well. Like, fortunately we're on 40 acres here, and we actually worked on doing a perimeter bushwalk around the whole property, which is amazing. We've got a new fire pit. We're looking at an outdoor pizza oven and a sensory garden. So just projects that were there, we can actually do. Our weekly peer support group is going online. If there's one benefit to COVID, I would probably say how it's brought the aftercare programme a bit to get more together. Normally we run an aftercare group on a Friday afternoon at the TC, but we've actually gone online, and it's on Zoom, so it means people from around the state can actually Zoom into these meetings. But you know, in the future, that is an addition rather than a substitute, I suppose is what I'd like to say. And one other benefit really is the Welcome House. We've been building the Welcome House since November, which is a whole different presentation, to be honest, but that's been continuing, and that's due to be finished in the next week or so. Just on retention, we were really worried that our numbers would drop quickly. We were thinking, you know, it could go down to 50, 40, 30, 20, and we had like models in place, like what happens if and if, but we actually found that the retention was amazing. We never lost one resident through the whole of the first lockdown. 47 started the lockdown and 47 finished. And then that lockdown finished, we thought we had a glimmer of hope, and we started getting residents in. We were looking at leaves, and then lockdown number 2 came, and even more so. But we've had a couple of discharges, but overall, the length of stay is actually 212 days, roughly 7 months. So it's quite phenomenal that people are with us that long. But over 70% of our community are now in the mid to late phases. And that actually will have a knock-on effect to our aftercare programme. We've got 2 houses in transitional integration houses. In Pakenham and Mentone, there's 12 beds. They're fairly full, and we've got a wave of 30 to 40 residents coming through at the moment. So it means that we're looking at modifying that programme and expanding that programme. Fortunately, we've got like 5 main houses at the TC here, and one of them we've actually adapted to be our seniors in aftercare house at the moment. And we've also had to look at the graduation process, that has to change as well. Just mention staffing as well. I'm aware of the time, so I'll not take too much longer. We are aware that staff are the kind of weak link in the chain when it comes to COVID, since the residents really only go off property for emergency appointments. But I'm pleased to say we've had no positive cases with staff or residents at the farm. All staff entering, we have to go through a COVID screening station where we sanitise, temperature check, don a mask. And in the past 3 weeks, we've actually gone from no masks, then we went up to the cloth masks, and then we've had to now wear the surgical masks. And it's just become part of the process, to be honest, coming into work. We have to wear them at all times, even in groups. If I had the time, we took some photographs and a kind of mock groups with some staff just to see what it looks like. It looks quite bizarre, to be honest, but it's become the norm. Residents don't have to wear masks unless they can't social distance in certain job functions like the kitchen. And it's just strange times. We've actually got a police checkpoint just down at the road before you turn into the TC. So our staff are going through this police checkpoint every day. And it's just bizarre. It's like something out of a movie, to be honest. But, it is kind of working as well. Like, we've got no cold and flus around. Normally we've got half the community, but half the staff out at the moment. And it just shows social distancing, hand hygiene, masks, and staying at home when sick is actually working, I think we've had 5 residents sick over the past probably 6 months, really, which is really unusual for us. But there's no doubt there's extra stress on the team. There's quite an overwhelming feeling of Groundhog Day. The second lockdown has been harder, and it really is impacting some people's and their families' lives. A lot of stress. Staff are not getting the normal breaks. We're really restricted what we can do when we're not at work. We can only go 5 kilometres from home to exercise or to buy food. Staff are not taking normal annual leave, but we're encouraging that. And we've had some staff that are actually working from home now for 6 months, and for some of them they live alone as well, and that's a real stress for them as well. So it's around staying connected and having like virtual coffee catch-ups to keep them connected with the farm as well. Group supervision, reflection has gone online, another difference. And lastly, I would just like to say, hopefully we never go through this again, but I think like the strength, resilience and connection of the whole community has really been heartwarming and inspiring, and something really special to be part of as well. So I'm happy if anyone wants to reach out at any point over the course. I'd just like to thank you, and I'll pass you over to Jade.
Thanks, Dave. So I won't take up too much time, but I just wanted to touch on, I guess, my experience being a resident here at the TC. So visits and leaves got put on hold at the end of March, and that's had a massive impact on me, and I know it has for a lot of my peers. I don't think I realised how much that helped, looking forward to having those leaves and having those visits to keep the motivation levels up to continue through. So when they were put on hold, yeah, it had a big impact. It had a big emotional impact, I guess you could say. So we sort of had to band together and rely on each other and support each other to help lift our spirits up. So we would put activity proposals in and organise weekend activities. Sort of staff, you know, helped us use our initiative to put things together so we could keep distracted in a healthy way and keep the motivation levels up. So, you know, we would dance together, we'd do cooking workshops, we'd do knitting and crocheting, we'd do sport, any sort of little activity that could help boost us and keep our spirits up. So yeah, it has been a really tough time, but looking back on it, yeah, it had its benefits for me. I feel like the community has really banded together and become really close-knit during this time. You know, this is an adversity that we're all in together and we're all facing this together, and it has been very trying, but we supported each other, we've lent on each other. It was really hard when we had to stop hugging. You know, we're a big hugging community here, and we had to sort of revert to elbow taps, which was different. Yeah, took a little while to get used to. So yeah, I won't lie, it's not been easy. And especially when stage 4 came in, and we also made a lot of our own masks, and we wear those in our big meetings. And like Dave touched on, when we're dining, you know, we used to sit next to each other, and now we're one at each end of the table. And, you know, it took a little while to get used to, but because it's gone on for so long, like it's been said, it's almost second nature now. You know, we also get our temperature checked every morning now when we come in for breakfast. So, but the extra FaceTime calls and extra phone calls on the weekend has been really beneficial in helping to maintain that family and friend connection that we lost when leaves and visits were put on hold. So, yeah, it's been really hard, but at the same time, it's helped bond us together and form deeper connections in the community. Like, we've really stuck through this and we've grown stronger and more resilient for it. Yeah. Thank you.
Okay, thank you all. Claire, just before you go, there has been a question that's come through, which is, what are the gaps you have identified from having a positive in a withdrawal unit?
I was actually typing an answer, but it got so it's probably easier if I just speak to it. Probably the biggest learnings are around making sure you trial all your procedures and your checklists. Do dry runs with all your staff, and who are your key sort of if you've got a COVID management team, who are those people? Make sure everyone that's going to be taking a part in actioning one of these events, that everyone's totally aware of what their role is. You've trialed all your checklists, all your documents, to make sure it flows as it should. Across the board too, and not just at Windana, one of the other clear messages has been around communication itself, and making sure that, you know, you may have particular lines in your different documents. Make sure that all your systems are up to date, all your contact details of all your staff are up to date. Making sure that if you're going to send out, you know, you have to send out messaging very quickly. So if you need to contact all your staff, you need to make sure that you've got a system that will send out to all your staff immediately with what your message is going to be. And often it is that you know, there's a positive case, the unit or whatever is going to be shut down. You know, directing people to go and get testing. So in Victoria, and like everywhere else, if you show up and you're asymptomatic, you probably won't get tested. So it was, we've since spoken to the department about if that happens again, if there's another positive case somewhere, how can we get staff tested because they've been in a unit if they're not necessarily classified as a close contact, and they are asymptomatic. So we've looked at like, how can we do something around that gap in particular? The other thing is too, is that, and I suppose it's probably a TC, drug and alcohol thing, you're probably going to move faster than anyone else. So you're going to move faster than the contract tracing teams. You're going to move faster than anyone in DHHS. So you're probably going to be days ahead of what they're doing. So in some ways, it's you're going to be leading them. They'll be catching up to what you're doing. So that's an important thing to know. Like, if you're kicking back waiting for them, you could be waiting for some time. If you're in a state that's in, like a state as in, like, you know, in Australia, not like a affect state, but like, you know, you're and you're in the situation we're in, there's so many people, and there's the contract tracers are so overwhelmed already. It can be quite a long time. Like we had, I think there was one case, Emery will probably know this more than I would, but I think it was about 5 days before someone got contacted. There can be big gaps in time. So you've just got to be aware of those facts in the beginning. But the big thing is the dry runs. The more that you can do of that, the better you'll be ready, and all your staff will be ready, and it will hopefully dilute some of that anxiety that everyone is going to be feeling. The other thing is probably, you know, that post work that needs to happen, what you need to do post to get everything reset up. And I mean, if you can think, if it's a smaller service you've got to shut down, there's an awful, if you've got like pharmacotherapy on site, that all that sort of, there's so many areas that you've got to think of. Like, we have facilities that never close. So if you've got to close, there's an awful lot of stuff that you've got to take into consideration. And the other part of it is that it's exhausting, believe it or not. And even though sort of the TCs weren't immediately affected by our withdrawal unit, it has a ripple effect through the system. So you've just, everyone's, you know, you've just got to be aware of that effect that is making its way through your organisation, and just, you know, look after the people as best you can while that's going on.
Okay, thanks, Claire. I think now we'll go to Odyssey House Victoria. So we have speakers. They are Andy Hick, Program Manager from Odyssey Circuit Breaker Program, and Tim Flora, the Program Manager from the Therapeutic Community in Melbourne, with Melbourne being the epicentre. And we've got Andrew Adam, who's the Program Manager from the Bairnsdale Program, who will share his experience beginning operations in the midst of Level 3 restrictions. So I'm not sure who's going to start. Who wants to start? You, Andrew, thank you.
I'll start. Look, our experience has been very similar to David and Jade's experience at Windana. We're not in Melbourne. We're in a rural area, and we're still in stage 3. I won't go. It was interesting, you know, without having spoken with David during this period. It's interesting that so many of the things that you guys have been doing there, we've done here, and I won't go through the details, because many of them are almost exactly similar. But and I'd also agree with what Claire was saying, in that one of the really difficult things, certainly for me and the assistant manager here, has been rewriting policy. But, you know, there's an avalanche of rewriting and restructuring what we do, you know, sometimes from day on day, as well as running the program. Our retention's been the same as you guys in Windana. We've had almost 100% retention. And we've had a really big resident involvement in trying to find meaningful and therapeutic activities over the weekends and evenings. Previously, we did a lot of work in the community, volunteering, and also we would attend 12-step meetings as well. naturally, we're not able to do that. We only go off site in emergencies. And the residents have been terrific in coming up with ideas and participating in the things that have been organised. It's been very interesting. Staff, I'm sure everyone had the same experience. A lot of anxiety at the beginning, and we were down 30 to 40%. People were sick, or they were anxious, or they, all of the things that you might expect. And naturally, in a small program like ours, that put pressure on the people who remained. And now we've become a little bit more nimble and adaptable, I think, with staff needs for children, and all the schools are shut down again. It's a question of common sense. I think, as Claire was saying, you don't always get a guideline. You've got to use your common sense, and being nimble and dexterous in what it is we're doing. I mean, we've changed a couple of quite a few program ideas, given that we have extra time on site, and also as well as socially distanced staff, we have temporarily distanced them. So we've spread people around the roster more so than they were before. There are more people now on weekends and evenings, and we've also made sure that there's a manager there on site for almost every day of the week. But it's interesting and heartening to hear that David and Windana have had a very similar experience and have put in many of the same things we have.
Great. Eric, sorry, I didn't introduce you. Eric Allen's also here. He's the Executive Manager of Residential Services. Hi, Eric.
Hi, Vanessa. Hello, everybody. I'm more than happy for Andy, Andrew, and Tim to do the talking. So I mean, look, I think really the thing is that the takeaway point for me in all of this is that to treat this pandemic like it's a bushfire or any other emergency. At the end of the day, as Claire said, you're going to have to make the best decisions you can, knowing what you know about infection control and being on top of it. I think doing your trial runs is absolutely essential, and you'll learn a lot from that. And at the end of the day, if you're doing the best you can, that's as good as it gets, really. And you can't sit back and rely on the health department to come and save you or necessarily direct traffic, even though they will be in touch with you as you go through all of this. But our experience has shown us that we're the ones on the ground, and we're going to have to make the decisions. Thanks, Vanessa.
I might jump in and give you a bit of our experience, if you like. So we had a case where we actually had an inconclusive result, because we've been constantly getting our residents, when they come present to medical with symptoms, to go off to the Austin to be tested. And at one point we had an inconclusive, and in between the contact tracing team talking to us about that, we got the resident retested, and that came back negative. But after that second negative result, the contact tracing team contacted us and told us we had a positive, which I talked to them about as an inconclusive. But we went into a run of trialling what that would look like as having a positive. It was certainly a really interesting experience and taught us a lot, as you've heard from both Eric and Claire, about what happens. I think some of the key takeaways for us was some of the staff appropriately needed to go home, self-isolate and care for themselves, which was okay, which left us with some staff that were able to stay. We certainly needed to improve our PPE processes around that. We also had a couple of staff members that stood up and really helped coordinate. I think you need to have in your plan, it's very similar to that initial bushfire. It's who's on is on, and they need to be ready and prepared. So you can't just rely on key people. You need to be able to be flexible and have more than one person being able to respond and take charge. I think that's really important. And another aspect is that we really took away from it was how draining it was, and that luckily at the end of the day, we got confirmation from the Austin that the resident was negative. So we took ourselves out of our lockdown process, but the staff certainly noticed how tiring that was. And if we had to continue that lockdown for multiple days, it would have been really difficult to sustain that level of energy and process. And so I think that's an important part of thinking through what it really looks like over time and how we can actually manage the workflow through that process.
Yeah. And I think one of the key points there, Tim, was that we actually had to chase the results. The results didn't come to us.
So as Claire was saying, we were ahead of it rather than behind. And that's often, so we were sitting there making decisions as we go rather than seeking guidance from DHHS. I think that talks to have your plan and really be talking and thinking about it. Good point.
Thanks.
I might just jump in here and say if anybody's got any questions, I'm not sure if the Q&A panel's working. So if you want to just pop them through the chat, then I think we'll get to them later on. Thanks.
Does that mean it's my turn to talk about the joy of trying to start up a TC in this unusual times? So what I've heard from David, Andy, Tim, Claire, we've experienced all of that, plus having the joy of trying and get the place up and running at the same time. I kind of personally wondered whether the universe was playing a bit of a joke. I landed in Victoria from another state in November, and it felt like the middle of winter. Within a few weeks, it was like the whole place was on fire. And then we've gone from the fire across to, which certainly did impact on the local area up here in East Gippsland, and then COVID's hit. And that's caused a lot of disruption and a lot of anxiety, but I suppose we've all experienced that. So when I think about some of the key things, I mean, we actually started a significant quantity of our staff training before we'd even open up the building, because we were never sure when the building was going to be ready to occupy. And during the training is when COVID became an issue. In fact, we had some colleagues from Windana with us, and I think there was all of a sudden there was a conversation about one of those people's partner had possibly been exposed, and all of a sudden they were no longer training with us. So there was, our training sessions got sort of cut in half in terms of the number of people that were around. Then we were going to have the first group of residents come up and help us set up the culture sort of early April, when we finally knew when the building was going to be ready to occupy. And then there was a positive down in Lower Plenty, or not a positive, a possible infection. So that pushed us back a week. One of the other things that was happening with us in terms of setting the culture early on was we were getting lever level residents from Lower Plenty up for a week to assist us. I had a couple of visits, and really that's fallen over because COVID means that we don't want to have any possibility of transferring an infection from Melbourne up to this end of Victoria. There were other things as well. In terms of our intakes, we had kind of predicted we would probably get somewhere between 4 and 6 intakes a week. We're kind of averaging 1 and a bit at this stage. Some weeks we've had 3, other weeks we've had none. And now that Melbourne's in stage 4 lockdown, we're still getting a trickle from other regional areas, but it's not actually given us the number of intakes, which would have given us the expected sort of number of residents so we would actually have been at capacity now. So really we're sitting just under the 20 at the moment, which is not really enough to run a TC in terms of the way TCs ought to run in terms of different levels and things like that. So that's provided some challenges as well. What else was there? I think from another point of view is that there's only a couple of us of the staff who have a good history in the health professions and understand infection control, and so trying to get people up to speed and actually understand the subtleties rather than responding to anxieties or questioning how to wear a mask or trying to pick up other people on PPE processes has been interesting. And that's an ongoing effort as well, just in terms of getting staff up to speed. So not only are we getting our staff group up to speed simply in terms of the way a TC runs, in terms of some of our processes, but we've also had to add on top of that, as you guys have all done, issues around training people in infection control. And, I suppose from a personal point of view, I go to the shops and I have a grin on my face from ear to ear, watching people think that having a mask and then gloves on means that somehow they're magically not transferring from what they've touched from one person to the next person. So there was other stuff around, I think Claire mentioned, or maybe it was David, around, it wasn't, around hugs and stuff like that. So I find myself being the social distancing, I don't know what you call it, indicator. Often I'll just remind people to keep the distance because they're just not doing it. We had to change furniture. Our initial settings for the dining room were such that we had sort of bench seats and stuff like that. So we had to go and buy a whole lot of furniture, and we've now got a whole lot of little cafe tables set up at approximately 1.5 metre distance from each other. So there was that sort of stuff. Some of the equipment that we were waiting for when we set up, or when the building was being built, didn't come in a timely fashion because it was sitting on the docks. If it came from China, it certainly was delayed as well. So there's been a whole lot of range of things that certainly added to the day-to-day stress of setting up a new program that didn't really need, but we just get on and deal with it. Happy to take questions.
I just might jump in and say I just noticed there's a question from Marion, getting results. I think that is actually worth talking a little bit. Initially, when we started to send residents to get results, as part of our isolation process, we would give them a mobile phone and they would take that with them. So we've tried a couple of ways of receiving the results. We've tried them faxing to a general line, we've tried them emailing us, and we've also tried texting to the mobile phone that the resident was given. All of those have had points at which they haven't worked as successfully. So in the end, what we've done is when a resident's getting tested, they give the hospital, which is the Austin Hospital, my phone number, and the Austin will then text me with a result or call me, and I've been able to manage that process and make sure we get that timely communication happening. And the texting from the Austin's been timely and really useful. So I think working with whoever's doing your testing and determining how to get those results most effectively is really worthwhile, because we had a couple of times where people in isolation stayed more than 24 hours past when they needed to, and they were deemed as negative. So those things are just, we've been working on the fly, but that's certainly some learnings we've had.
Do we have any more comments from the panelists? We haven't got any questions through.
There was one thing I forgot to mention. Normally when you open up a program, you get a good opportunity to celebrate it. The local community gets to participate in that. So things that we were hoping to do, Eric and myself and our Aboriginal consultant had gone and met the local Aboriginal groups, and we were hoping to have ceremony and smoking ceremonies and a whole lot of stuff like that. So from that cultural point of view, we've basically been talking to them via Zoom, but things just haven't happened how we would have hoped. So there's And so, you know, even the local communities that put in so much effort in terms of getting us built have not had the opportunity to be part of the celebration of actually us starting on our journey as a TC.
Maybe that's a good question for Jen that I've just seen pop up.
Can you see it?
Jen, it's Jen, right? Jen, there's a question there about how do you find mask wearing effects establishing therapeutic relationships with the clients?
On if you want.
I think it can be a little bit confronting for residents, but it's almost second nature now. Yeah.
I think that's my sense as well. We're getting used to it. It certainly does put some distance, but it just means you have to do a little bit more extra work to make sure that you're portraying through your eyes expressions or emotions, and make sure you're smiling with your eyes, those types of things. One of the things and the way we've been operating, because we've also got children, so our children's centre staff are not wearing masks at the moment, and so the children have that sense of safety and security, and they can see what's going on in the children's centre. But everywhere else the staff are wearing masks, and I don't get a lot of feedback other than we're just getting on with it. It is what it is. People have accepted it for what's happening. It's not like we have a choice anyway.
Yeah, I've actually found, like I was saying, we took a couple of mock group photographs with staff, and I actually found an old photograph from about 6 months ago when I was taking some photographs for some other presentation with staff as well. And looking at the comparison now, like the staff, the way groups used to be set up, where everyone's in quite a tight circle, it actually looks odd now. It actually looks, we're so used to large open spaces, social distancing, that when you actually look back of how we used to do groups, it actually looks odd. And it's just weird how we've adapted to the change. And yeah, in fact, when I take a mask off now, it actually feels odd as well. Like you seem to just adjust. We were really concerned about that therapeutic rapport that you would get with residents, but it just seems to be something that's it's kind of just flowing through, isn't it? It's hard to say, really, but it just kind of works.
There is one advantage, Dave, for those times where you do want to maintain a poker face. It makes it a bit easier.
Very true.
Can I just touch on one other point that I've experienced during the COVID, is with the integration house. We would have the peers come back on the Wednesday and the Friday to do program with us. And we're encouraged to keep those strong connections with the peers that are in the integration house, the Judd house. Since leaves and visits were put on hold, they actually need to stay at their house, the integration house, and not come onto property. So we've been doing lots of our phase groups via Zoom with them. And I guess that's probably, it has had an impact on maintaining those strong connections with them. That's, yeah, something that I didn't think of before. Yeah.
Thanks for that feedback, Jay, because in our service, we were getting a lot of pushback from our, I guess, equivalent integration houses, and we call them transition houses. And there's a lot of pushback that they were losing a lot of privileges, like going to outside meetings and what have you. And it's comforting to know that we're not alone doing this. And regarding the mask, I mean, when I was overseas, when everybody else is wearing a mask, you don't feel like you're a bit weird. And when you go into Coles or Woolworths and everybody's wearing masks, you feel fine. But it's when you're one or two people alone, that's when it feels a bit strange. One of the things I'd like to say, hearing everybody talk today, I thought that bulk SMS was a good thing to think about. I know you can do bulk SMSs from a computer system. I'm just wondering how Endana is doing that, whether it's being done by one central phone or by the computer system. So that's one question. And also, we're about to implement what we're calling COVID drills, just like a fire drill, a COVID drill, which looks like you're already doing it down there. And that's also good. It would be good if we had some central place we could share some of those checklists, because I know all managers at Who's where they're going to get a visit soon in a COVID drill, and we'll see how we've split our plans into preparation, implementation and outbreak management plan. And I guess we're ready to install the outbreak management plan, because we're taking the stance now that's not preventing getting COVID, it's when we get it, because I think we have to be prepared that when we get it, because I have colleagues overseas running therapeutic communities that on the first day someone tested positive in the TC. By the third day, 37 people had tested positive, and by the fifth day, I think it was 60 something. I mean, it can go that fast. So I'm on my high horse at the moment trying to get detoxes. But while it's not going to shut out all risks, but detoxes to do testing. So like you had down there at Victoria, when you got that positive in the detox, if those people were allowed out, they could have gone through 3 or 4 centres, and then once in, we know how fast. Doesn't matter how good your infection control guidelines are. People are touching doorknobs, light switches, accidentally coughing, and as we know, residents, they start off social distancing in the morning, and by 1 o'clock in the afternoon, it's like herding cats. They all start talking together, grouping up together, and you've got to continue. And we put a process called each TC has got COVID monitors. So it's a job function, or what we call chores function now, that the COVID is part of a job of someone to continue, not give awarenesses or give infractions. It's about making people aware on the spot if they're infringing a social distancing, which is obviously the big one. I'm just wondering if there's any, and also the other thing there, I'm sure, I'm hoping we've got something in place, especially around OTP, like some of you there, we've got a method of opioid substitution and opioid reduction programs. What happens if we get slammed? We have a public health unit that can come in, and no matter what we're trying to do, they could come in and go, you're shutting down. And if we do get that order, how we would put the shutdown in place to actually make sure people can get dosed somewhere else. So that was a good wake-up call hearing that. I'm just wondering if anyone's got any replies to any of those comments I've made.
Sure, I can jump in and say, Garth, we've because we are still continuing to admit, and we have had an admission one morning that did come from a detox where they had a positive. And our staff did really well at our admission centre and were doing all the right social distancing and wearing masks. And that person that came from the detox, unfortunately, we had to cancel that admission on that day. But the detoxes have been really fantastic in working with us to support us to make sure they're doing their best to get people tested before they come in. And we're also trying our best to make sure we do bulk admissions. So essentially they have a period of quarantine in the detox as best as we can. So we're trying to make sure we're covering as much of what we can in that process and communicating effectively. And I think at this point, touch wood, that's been working really well. And that relationship that we've been building with the detoxes is working really well and has really been strengthened through this. So it does feel like the sector's come together in that way, and it's been really useful.
Can you just explain what you mean by the bulk admissions?
Why? Or
what you mean by that, a bulk admission?
So what we're trying to do is the admissions team's trying to work with the detox to say we've got 3 or 4 people that want to come in. We'll try and book them with one detox so that detox, they do their 7-day detox as a bulk without anyone else coming into the detox. So that they're all contained within for that 7 days in that effectively a quarantine process. so you don't have the same ins and outs.
Right, that's a great idea.
Yeah, that's really been an effective way to make sure we minimise our risk while we're doing admissions.
Okay. There was one other question from could you explain the rationale behind reducing group time from 1.5 hours to 45 minutes?
Yeah, that's around close contact. So it's just the amount of time that you're actually in the room with people at any one time, and then the chance of you know, infecting other people. So if there was COVID virus around, obviously the greater time you're in a room, then the better chance there is of infection being transferred around the room. So, and there's some recent numbers that have come out of recent information that time is even accumulative. So it's not like, you know, 2 hours. It could actually be 45 minutes one time, 15 minutes another time. So it's really just trying to limit the chance of transferring any infection if it was to arrive at the TC. Hopefully that answers.
There's another question there, Vanessa.
Yeah. Does the centralised referral system still operate in Victoria? If so, how does the centralised referral system fit into the new protocols for COVID safe practices by TCs?
Yeah, that's a good question, Jared. It is still going, so it is definitely a centralised referral system. We're trying to we're still trying to effectively do that same bulk admission. So even though we've got people coming, rather than book them into the detox maybe locally, we're booking them into a detox that can do that bulk admission. And that's essentially what we're doing as part of that process. I'm not sure if that answers your question, but.
Well, I think if I can just add one thing, Tim, I think it's adjusted to everybody's COVID practices.
Yeah.
Because the admissions process is obviously different at Bairnsdale and Benalla. But yeah, it has. You know, it's adjusted to it.
But I do think my sense is that people are working together, so they do understand what we're trying to do. And that adjustment has come through collaboration, and that's been a real benefit of drawing the detoxes and the TCs together to make sure we're communicating and working together. I know we're about to do a transfer between Windana and Odyssey shortly. We've been doing that throughout the pandemic, so it's really great to see that we are all in this together.
So when you mean transfer, you mean if you're discharging someone rather than putting them on the street, you transfer them to another TC, is that what you mean by that?
Essentially, that's what's happening. We've got someone coming from Windana soon. We've had people that we've asked Windana to support us with. So, you know, it's about working together, and I think that's been really effective.
Okay, that's great.
Right. Yeah, I don't think there's any more questions. Does anybody have any further comments? Panelists? No?
One thing, look, I'm really happy with these 1 hour grabs, because I think sometimes we look further afield than we need to, and I believe what we've got amongst our own TC network is very, very strong. And I think today just shows that. I want to thank Odyssey and Windana for participating in this one today, and also encourage, if there is a part 2 of this that you would like to see in a month's time, or if you've got other issues or other items you would like to see discussed amongst the network, I believe amongst us we've got all the expertise required to be able to share amongst the networks, and I'd like to encourage that moving forward. That's all I've got to say, except thanks for everybody, thanks to the panelists, and thanks for everybody. I think we've got 50 odd people that have logged in, which is a great rate. And again, I think it's practical, only having to give up 1 hour of your day to share this important information. And this way we can do it more often. So thanks again, everybody.
Thanks. And I'll be sending out like a questionnaire evaluation where I'll get everybody's ideas on anything that you want to talk about in future, because I'd like to do these quite regularly. And also just a special thank you to Jade for giving us her time and experience. That can't be easy, so thank you, appreciate it.
Just Vanessa, there might have been someone who's missed today. You've recorded this today, have you?
I have, so I'll get a link and work out how to get it uploaded so everybody can have access to it, and I'll send that around.
Great. Thanks again, everyone.